My name is Dr. Anna Farrell, and I'm a clinical and school psychologist and an associate professor in human development and family studies at the University of Connecticut. I'm also core faculty on the LEND training program here at the Papaniku Center at the University of Connecticut, which is a University Center of Excellence in Developmental Disabilities. I'm going to provide today a brief introduction into issues surrounding diagnosis and assessment in the field of developmental disabilities. This is an enormous topic. So what I'll talk about is really just scratching the surface of a field that is vibrant and expanding and quite dynamic, changing all the time. To begin, it's helpful to define terms. And the first term I'd like to talk about is assessment itself. Assessment is an information gathering process. It's a process in which, in particular in the field of developmental disabilities, the evaluator works in close partnership with family members and caregivers and support providers to paint a picture of an individual's functioning. And that picture is best drawn by examining a person's level of competence and skill, as well as their impairments and difficulties, and to talk about both strengths and weaknesses within an everyday context. That may or may not sound like an enormous job, and in fact it is an enormous job, as we are really complex beings, all of us. And for the most part, assessment in the field of developmental disabilities occurs in the context of, number one, trying to determine eligibility for services, which technically is an evaluation. So an evaluation is an assessment for which one of the primary outcomes is determination of eligibility for some service or benefit. And assessment is a process that requires us to take a snapshot in time of an individual, but also to use that snapshot to predict the future. And the reason we want to predict the future is we want to take our current understanding of an individual in context and imagine how a set of supports or services might better enable that person to be the best that he or she can be. In other words, assessment, a primary goal of assessment should be to paint a picture of an individual that helps a team of people to promote optimal outcomes for that person. And those outcomes really have to be considered within the individual's everyday life. So an assessment is a process of information gathering. It might be done to determine eligibility. There are often products of assessment, and those products are usually take the form of reports. They're often detailed multi-page reports produced by each of the disciplines that might see an individual who has or is at risk for a developmental disability or a related disability. And a related process and outcome of many assessments is a diagnosis. And diagnosis is often thought of as something that happens in the field of medicine, and in the field of medicine and in all the fields related to disabilities, a diagnosis is helpful because it provides us a shared vocabulary. So if we talk about a diagnosis of an autism spectrum disorder or Down syndrome or Fragile X syndrome or any broad array of diagnostic categories, that diagnosis itself will tell a bunch of different professionals and family members that this individual shares particular features with other individuals who have who meet the same diagnostic criteria. That's important for efficiency purposes. It's important because it gives us a shared language, and it's important because it helps us to recommend the interventions that we know are likely to be most beneficial. So research has enabled us to understand over time, and continues to help us understand over time, how we might best construct a set of supports and services that taking into consideration that assessment information will help optimize an individual's functioning. The family and the individual with the disability are critical members of an assessment or evaluation team, because no evaluator, regardless of their discipline, knows the individual as well as the individual and his or her family. And the evaluator is a fleeting presence in the individual's life. The family and the individual, of course, are the mainstay. And so the information that is brought to this assessment process is only complete to the extent to which the family and the individual have contributed something meaningful to that process. That sounds easy to do, but in reality, it takes a great level of flexibility and skill on the part of the evaluator to meaningfully include the family. And in order to be a meaningful part of the evaluation or assessment, the family has to engage in a learning process, and the professionals need to make sure that the family has enough information to make meaningful contributions to that assessment process. So I just defined assessment itself, evaluation, and to some extent diagnosis. So diagnosis is generally a term or terms that efficiently describes a set of symptoms or characteristics that an individual has and helps us understand how we might best construct a set of supports and services that will help the individual to gain more competence over time. There are a number of diagnostic classification systems. The most common of those emerge in the field of disabilities. We have the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. Most people are familiar with the International Classification of Diseases, the ICD. And there are a range of sort of pseudo-classifications that emerge from federal and state regulations about eligibility for services. And those include definitions from the Americans with Disabilities Act, from the Individuals with Disabilities Education Act, from early intervention programs, and so forth. So what happens in an evaluation that's well done is all this information is brought together, and the individual is seen, hopefully, in as natural a context as possible. The more natural and contextualized the assessment is, meaning we want to see the person have the freedom to behave as they normally would. We want that picture of the individual, that snapshot, to really resemble who that individual is in everyday life. And if we do a contextualized assessment, we're more likely to get an accurate snapshot. That contextualized assessment can be done using standardized tests that inform the evaluation itself, but it also involves sort of unstandardized assessment methods such as play-based assessment, classroom observation, and informal observations across a range of settings. So in summary, the process of assessment and diagnosis in the field of developmental disabilities is a complex one. It's one that all of the disciplines involved with disabilities have important and meaningful contributions to make. And the best assessments happen in the most natural contexts possible and can employ standardized methods that help us make comparisons to the larger population, but also involve natural methods and families as partners so that the snapshot that we have of that individual is reliable and accurate and valid and really helps us to predict a future where supports will be optimally tailored to that individual.
Thank you very much.